Now look at another surgery which is done for shoulder dislocation, okay, in orthopedics. And this is what is known as elbow arthroplasty, okay. And I just want you to work with me. Anytime you hear arthroplasty, plasty is like we are rearranging something, okay. So elbow arthroplasty, you said that is basically also known as elbow replacement surgery. So when you say elbow replacement surgery, most of the times it's so easy to the students. So most of the times they could tend to confuse you with using elbow arthroplasty. So it's a procedure, and this one, the damaged parts of the elbow, they are replaced with what artificial components. So this component could be made up of plastic, they could be made up of metal. Okay. So it's typically done when a lot of things have damaged the elbow to a stage that you just need to replace some parts of that elbow joint. Okay. So it could be arthritis, that's inflammation around the joint. It could be that the person has had terrible fractures. It could be that any other thing that is damaging the joint. So why is it done? Severe rheumatoid arthritis, osteoarthritis, post-traumatic arthritis. You have complex fractures. Sometimes you have cancers around that region of the bone, you know. So types, we have the one that totally the elbow is replaced. So the entire joint is replaced. This is a total, everything is replaced. Okay. This one is total. Okay. But sometimes it could be partial, you know. So we have the partial one. This one only some parts of the joint is replaced. They will have linked prosthesis where the components are mechanically connected for stability. So also have the unlinked one. That one is connecting with some natural ligaments and all of that. So surgery, the surgeon makes an incision at the back of the elbow. You now remove what is damaged. It will now shape the bone ends. You now insert what is supposed to be replaced, you know. So it's often fixed with bone cement, which we'll talk about that in orthopedic classes. So it's very beneficial because at least it will relieve the pain that you have been having around there. So to say, probably the damaged parts have been scratching on your nerves, on your blood vessels, on your muscles, so there's a lot of pain. It will improve how you are able to use that part of the body again. So there's better ability to perform daily activity. Okay. But the risk is, just so you know, every surgery carries the risk of predisposing you to infections, nerves could be damaged, blood vessels could be destroyed, and the rest of it. Okay. And sometimes you can have infections around, they call it the periprosthesis infections. What was replaced? If it was not done in a neat environment, you now have infections around that place. And most of the times, you have to take the patient back for another surgery. Okay, so I think that's what we have for the elbow arthroplasty.